Welcome back to Wave 3 Listens. Perhaps you've heard a lot about hormone therapy. What's the right choice for you? Are you a good candidate? What are hormones? There's so many questions to ask. Bottom line is it's about you feeling more youthful, and that fits right in with the philosophy of Physician Center for Beauty. With us now is optimal aging specialist Marilyn Cannon. Marilyn, welcome back to the show.
Thank you.
All right, before we get started on BioT and why BioT and what separates it from the others, let's talk a little bit about Physician Center for Beauty and what you, I think it's a perfect marriage of look good, feel good, right?
Absolutely. We're a full-service medical spa. We're led by Dr. Sean McGuire, who's a dual-trained head, neck, and plastic surgeon. We offer spa services. We offer non-surgical procedures. We offer surgical options as well, but we also offer hormone replacement therapy because we've addressed aging on the outside really well under the direction of Dr. McGuire for over 12 years. But we recognize that aging starts within, and that starts with hormones. And so we've done our research, and we've partnered with BioT Medical. BioT Medical is a leader in bioidentical hormone optimization therapy. And we're excited to offer this therapy to our patients because, again, we can help you look good on the outside, but we also want you to feel good and recognize that aging starts within and how well we take care of ourselves. And again, hormones are the messengers to all other cells in the body. So when our hormones are optimized, then other cells are optimized, and that equates to longevity, outstanding quality of life, as well as disease protection.
All right, this is perfect. On BioT, we're looking at some of the perhaps not only benefits, but maybe some of the red flags that you should be looking for. And let's talk a little bit about, and this is what we're talking about here, what are hormones? So when we talk about hormone therapy, okay, it makes sense you're replacing hormones that you've lost naturally through aging.
Yes.
But why BioT, Marilyn? Why would we go there?
BioT is bioidentical. Bioidentical is safe, it's effective, it's in pellet form, it's been around since 1939. There's decades of research that support the safety and efficacy of this form of hormone optimization therapy. There's different categories of hormones available, and most people are familiar with the synthetic forms. And synthetic forms come, Premarin, Prempro, and Androgel. There's all types of synthetic hormones available that people are taking. They're prescribed often by our doctors. But bioidentical hormones have been around a long time. The synthetics came on board afterwards. So and I kind of want to explain a little bit why that is, why our doctors aren't prescribing BioT unless they've become enlightened or have learned about this on their own, because this is not taught in medical school. Natural therapies are not taught in medical school. Western medicine is pretty much driven by pharmaceutical companies. So the pellet therapy started in 1939, was brought over by a physician from Europe who was treating menopause, andropause, and women who'd undergone radical hysterectomies to restore hormonal balance. And it was done safely and effectively. These pellets are plant-based, non-synthetic. The components of our pellets are FDA approved, and the processing of our pellets are actually overseen by the FDA to ensure the accuracy and the purity of the dosing and the hormone. But anyway, so the synthetics actually came on board after the pellet therapy was offered. The popularity of the pellet was there. However, pharmaceutical companies could not patent this natural plant-based substance, so they had to create their own chemical compound. So that's when Premarin came on board, which is horse estrin. And so it's a even though you might call it natural because it comes from a horse, it's not natural to our bodies. So it's basically a Band-Aid that treats symptoms of loss of hormone production. It doesn't really restore your hormones like we're doing with our therapy. So the synthetics also have a little bit of benefit, but you can't use it long term because it has some adverse side effects associated with it, like increased risk of cancer, breast cancer, blood clotting, and strokes. With BioT Medical hormone optimization therapy, we're actually reducing your risk of disease, including breast cancer and other cancers, Alzheimer's, dementia, heart disease, blood clotting, strokes, diabetes, osteoporosis, and on and on and on. So we're actually restoring your hormones in a way that's natural. Again, it's pellet form. It's smaller than the size of a grain of rice. It's inserted painlessly underneath the surface of the skin. So it releases hormones directly into the bloodstream, just like the testes and the ovaries do, and the adrenal glands. So it's released 24/7 on a steady stream over the course of several months, so you don't have to think about it.
All right. 5715263, if you have a question for Marilyn regarding BioT hormone therapy. Marilyn, I did want to ask you about symptoms. So what are the red flags or symptoms that people feel when they think, you know what, I should go in for a consultation? Let the professionals, tell me whether or not I'm a good candidate.
Yeah, so you're seeing them on the screen right now. Extreme fatigue, crashing at the end of the day. mood swings and anxiety, tension, irritability, lack of sleep. You know, I was waking up multiple times a night, and you might be experiencing that as well. Memory loss, depression, lack of focus, brain fog, hot flashes, night sweats.
Wow, I'm going check,
weight
check,
gain.
check.
I know most people are going. If you're over 40, you're probably check, check, check. But weight gain, particularly around the middle, joint pain, bladder symptoms, migraine, severe headaches, decreased sex drive or performance for both men and women. So these are all symptoms of low hormone production, and that starts occurring after the age of 30. We start losing, our hormone production by the rate of 3 to 10% per year after age 30. So by the time we reach our 40s, 50s, and 60s, we are really deprived of hormones, and so we're feeling that. And so typically those symptoms that we're feeling, we might be just associating with old age, but it's not aging. It is really low hormone production. We can live vibrantly for the rest of our lives if we choose to, by optimizing our hormones.
I choose to. I want a little help. I choose to. Okay, if you have a question, 571-5263. We're going to do this for you. If we have your attention now and you're saying, you know what, I've been waiting long enough. I needed some answers to questions. Marilyn has provided those. So I'm ready to at least get a consultation. You're going to waive the consultation fee.
Yes, we're waiving our $99 consultation fee. And it's important to come in and learn about this. If you're feeling these symptoms, if you're looking for a solution for this, then come in and learn if this is the right solution for you. I will give you some education on it. If you decide this is the right therapy for you, together we decide that, then the next step is I send you for your lab work. We do a comprehensive blood panel. We look at your thyroid, we look at your liver function, your kidney functioning, we do a full chemical panel. We look at your testosterone levels, your estrogen levels, we do a lipid panel, on and on and on. We get a really good picture of where you are health-wise, and then based on your lab work, based on your health history as well as your symptoms, then you have an individualized dosing that's prescribed for you. So it's not a one-size-fits-all.
Marilyn, you've been very forthcoming and transparent about the fact that you use BioT hormone therapy.
Absolutely.
So often I ask you about, how are patients feeling, and I want to hear about that, but I also want to hear about you personally, because I know you teach exercise classes.
Yes.
I know you like to horseback ride. Of course, you've got your full-time job.
Yes.
So for you, what kind of difference has it made?
It's made a huge difference for me. I'm 61. I went through menopause when I was 44. I did not choose to do any hormone replacement therapy until BioT. I started feeling the symptoms of low hormone production in the last 4 years. And so, fatigue, I wasn't sleeping well, started to gain weight in the middle, and I live a healthy lifestyle. I've written a nutritional program that I actually live by. I exercise regularly, so I was doing all the right things, but was still starting to gain weight, was losing muscle tone. So, I also had lost my libido. I wasn't interested in sex anymore, on and on and on. I mean, all the things that you saw on the screen, basically I was experiencing. So since I was pelleted, I can tell you dramatic change in all of those symptoms. I feel great. My energy levels sustained throughout the day. I've kind of regained my drive and zest for life that I was starting to lose, and my libido's back. I'm starting to see the benefits of my workouts now. I'm seeing the fat go away. I'm seeing more muscle mass. I'm seeing more definition in my muscles. So in every way, I've experienced positive results as a result of the pellet. And I'm not going to, and I will forever use the pellet.
There we go.
But our patients are saying the same thing.
All right. Yeah. Well, there's an endorsement there from Marilyn Cannon. So we've asked for phone calls. We go to the phones. Ask and you shall receive. Becky joins us now. Becky, welcome to Wave 3 Listens Live.
Thank you. I had a hysterectomy.
Go ahead.
And I'm also a type 1 diabetic, so I was wondering if it would affect blood sugars at all.
Well, it affects it positively, and we do actually look at your blood sugar levels when we do your blood work. But the pellet therapy will actually impact anything that you're dealing with, particularly you've had a hysterectomy. Do you still have your ovaries?
No, I have nothing. It's all gone.
So your body is very low. You're probably not producing any estrogen. You might be producing a little bit of testosterone. So you're feeling probably most of the symptoms that were listed on that on the chart when we showed that on the symptom list.
There we go.
So I think you'd be a great candidate for it. And it does impact if you have diabetes. Are you insulin dependent?
Yes, I am.
So I mean I'm not saying you're going to go off insulin, but we do see improvement in blood sugar levels with the pellet, as well as, of course, we're going to restore your estrogen and testosterone levels, and so you'll get great benefit from that, since your body is not producing right now.
Yeah, if you're wondering if you are a candidate, I highly recommend a consultation. And thanks to the special that you now have running,
Yes.
it won't cost you anything to go to the Physician Center for Beauty. Call them, set an appointment, and as Marilyn said, she'd be glad to talk to you, talk about your symptoms, and see if you are a good candidate.
Yes, and also, too, I want to let people, this is affordable. We don't charge management fees. We're basically charging for the hormone and the blood work, and we're just charging what it costs us for the blood work, and we have a wonderful arrangement through BioT Medical. And so I encourage you to come in and learn about this. It's affordable. It's about cost. It'll cost you about what you spend on a cup of coffee a day. So to feel better and to age healthier.
That's right, yeah. Energy, I'd much rather get my energy naturally than through that
Absolutely.
caffeine that I'm killing every day with about a pot and a half.
Yeah, you won't feel like you need coffee when you have pellet therapy.
I love hearing that. All right, Physician Center for Beauty, once again, the consultation is absolutely free. Just mention Wave 3 Listens Live. We're going to go to break now. We'll be back after these on Wave 3 Listens. It's the Monday edition. Welcome to the work week.